was the scan from 4/20/22, and it's very similar to the last one. You can see that the left lung's pleural sac is not completely, but it's pretty toasted. Once again, the brain, that's normal stuff here. Kidneys, that's normal. The ureter tubes come down. The bladder, I'm not sure why the bladder is doing the split thing there, but and then this is all normal here. These are probably just areas in the intestines that are irritated. Probably a lymph node, 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 lymph node. But I always have lymph nodes that come up on these scans. So the big change, well, not really a big change. It is a change, but the pleural sac is got a lot of activity in it. So as we rotate it through, you can kind of sorry, my voice is really hoarse right now. Kind of get an idea like how it's kind of spreading inside there. You can see you can see these air gaps. That's because the lung itself doesn't have any cancer in it. It's the pleural sac that goes around the lung. There's toast. So let me go ahead and just finish giving you the 360 here before we go on to the red scan. So this is just the whole body where you can kind of see what's going on. But the really good thing is bones are clear, spine looks pretty darn good. These are lymph nodes, I'm pretty sure. The liver has a tiny little warm spot, but I'm not too worried about that. These are, actually, I know what these are. These are the tumors that are in my hips. And we'll see that in a minute. So let me scroll up to the red scan. If I can find it. There it is. All right. So this is the where you can see everything that's going on. So this is brain. The brain's always going to be really hot. So they can't use PET for brain. They have to use MRI. Okay, so now we're getting down to the bottom of the skull, mid-skull, bottom of the skull. Never realized that my spine was crooked, but whatever. It should be straight up and down, but it's just kind of tilted. Okay, so as we go down, watch for it to be become like really bright. That's the areas where the cancer is likely to be. It's almost 99% cancer. Okay, so this is reversed. So it's left and right's reversed. So this is the left side. So these are. I thought they were lymph nodes. They might be a lymph node there, but what it is you'll see, is the pleural sac. That's totally toasted. There's another view I can show you that shows a lung, how it looks. So here you can see the pleural sac is super thick. It is so thick. I was like, whoa, I couldn't believe how thick it was. Now you look at the right lung, which is very healthy. There is no thickness around it. So this is all inflammation slash cancer just squeezing that poor little lung. That lung, this whole yellow space should be lung. So my lung's being squished. So we keep going down. It thins out a little bit in the back here, but see how bright it is? That means it's very, very active. So this may be my last PET scan before, the next PET scan might say, okay, we might have to try something else because it's not working for this. But as we go down, you keep looking at the spine because that's a very area of concern. That looks like a little lymph node. That's a lymph node. A little bit of a hot spot there, but nothing important. At least there is some lung expansion still there, so that's awesome. When I had my lung scan done, that's fluid. I had about a 30% decline in lung capacity because of this. So this is healthy lung. This is fluid that's not, tumors. So I have a big old pocket near the back. So next time they do a lung puncture, they're going to probably go through the back. That's one big pocket. But you know what's good is that there's a couple little tiny pockets here. They call that a loculated effusion. Now there's some, these might be some of the past bubbles that they've popped, but, or that could be, yeah, that has to be, no, that's lung, that's pocket. So that's what's left of my lung. It's just getting all squished. And it's this all this thickening, that's the tumors filling up that side of the chest, squishing the lung. So they can't do anything about that. You can't drain that. We can drain this, and that will give my lung a little bit more space. So I should probably schedule to have that done. Anyway, back so just to check the spine. We don't see any super hot spots in the spine, so that's beautiful. You know, the ribs look okay. I don't see any major hot spots, even with all this intersac, you know, the pleural sac being full of tumors. There's a lymph node. I think that was a lymph node there. Looks like I have an old hole there. See how it's not as bright like this? So it's an old hole. Just looking at these little spots in here. Like, what is that? Is that lung tissue? I don't know. I'm not going to even try to guess. I'm just looking at bones right now, and then here comes the liver. I think that was a spleen over there. Kidneys are starting to pop up. So here's a little hot spot they were talking about in my liver. Again, there's not too much going on there. It's just part of one of the lobes. So they said on I think it was a report that was a little less bright. Again, the kidneys, that's very normal. And then you'll see the little tubes that come up the ureters. They're carrying, they're transporting the radioactive blood, to the kidneys, be filtered and then excreted. So this is normal stuff. This is just the okay, so right here, I think it's in the T's, the lower T's, like T12 maybe. But this one, I think it was there last time too, but there is a tiny hole there. So it's a little, the nice thing is it's not near the spinal canal. So that's comforting. Hopefully it'll quiet down. Keep going down. That's normal. Well, I'm going back the wrong way. Sorry. All right. The uterus. That's normal. I think I had gas because I'm like, what's with this? I'm pretty sure I had gas that day. It's too funny. All right, spine still looks good. Now we're getting to the hips. So there's a lytic tumor. So lytic means that it's destroying the bone. So it's destroying the bone, so you can see where the tumor has destroyed the bone. Luckily, I don't think it's caused a fracture or anything yet, because I don't see any cracks or anything. So that it's kind of small, but it's still there. The bigger one's on the other side. So you can see how much brighter that is compared to this one. This one actually is not as bad. It might be dying. This one is quite active, so that's a cause for concern. But otherwise, there's not too much. So there's one hot one, really hot one there, and then the smaller, less hot one there. Yeah, it looks like I had gas. Oh, joy. So another thing I noticed too is I've been having right hip pain. So, okay, this is the right side. This is the left side because my lung issues on the left. So I have been having what I would classify as like a bursitis kind of pain. And if you look at the alignment of the spine with the hip, this one's pretty smooth, right? But look at this one. It's like popped up and it's making a lot of contact here. So I think I have a little bit of a degeneration going. There's a little contact there too. But this side definitely has more. But it's not really hot. So at this time I didn't have the pain. But in the last 3 days I've been in excruciating pain from this joint right here. And I've imagined that is inflamed right now. But it's because it looks like it's a little, not too bad out of alignment, but there is a little bit of a sign maybe. And this here, that might be a uter, I'm not sure. Oh my goodness, someone's blowing up my phone. All right. So go through here. You know, there's a lot of redness here. I've been having intestinal issues, so not bad, but enough to maybe show up on a scan. But it's not horrible though. All right, no really big hot spots. A little bit of warmth in there, but not too bad. A little bit of hot spot there. Probably intestinal. Or we're getting close to the bladder here. So, so I guess this is a bladder. When I saw this, I'm like, what the hell is that? I don't know what that is. I don't know if that's my fibroid. It could be a fibroid, but or it might be the gas. So I don't know. And then I guess maybe this bubble was pressing on the bladder because it looks like the bladder is kind of almost bifurcated. So that's really strange. Yeah, okay, so we go down through the rest of the pelvic area, and we look at the bones in the thighs, because a lot of people who have cancer, they get a tumor in their thigh bone and they don't know it until it breaks. And I don't have that problem right now. There's no visible really activity. So that's the what do you call it? The head to toe one. So this is the side view. So they're scanning me from left to right or right to left. You see my arms and legs getting a little deeper. This is the left side. You know why I know? Because that's already glowing. The right side shouldn't be glowing at all. So you can just see the scope of the glowiness. So as we kind of penetrate, slices through from left to right, you'll see where the lung starts to, be able to expand there. And there's just all this gunk that's just growing around the poor lung. And there's a sac of fluid again that's in my sac of, not in the lung, but it's next to the lung. Yeah, it's in there. So it's in the back, so it'll have to go right under the scapula, it looks like it. All right. So you can see, wow, so this is my heart. So what's going on is this, and this is more of the right lung here. But, excuse me, left lung, and that's the bubble there. So that's just this lung area. This should be lung, and it's not. This is lung. The dark areas are the lung. And then somebody looks a little glowy. It's just because the way the radiation kind of glows. It's just the way it spreads out a little bit. So I hadn't realized that my heart was also getting surrounded by these tumors. So that's going to be interesting to see how that affects my heart. I've been okay. I was sick for about 2.5 days with a pretty high fever. The people at the oncology said you should have gone to the hospital. But it was just a post-chemo fever. I didn't have any of those problems, So I'm like, I don't want to go there and potentially get exposed to someone's flu or whatever. So, am I going the wrong way? I think so. Yeah, I'm going the wrong way. Okay, so that's the lung, the fluid, and the pleural sac that's just getting hammered. All right. Looks like there's a little hotness between those two vertebrae. It's probably because the pleural sac is right there too. You can see the ureter tube and the kidney there. That's normal. All right, let's see. Oh my goodness. That's a lot of tumor activity and inflammation. But so the heart, let me kind of get the scope of that. The heart is like, what happened? It's like almost, it's like half of it's surrounded by tumors. But the heart itself is fine. These look like lymph nodes. That's just part of another tumor. All right, let's go through. All right, getting through going the wrong way again. All right, so you can look at the spine. There's not a hole. I have a couple of little holes. We already knew that. Not a biggie. Now that might be the one that's got the little tiny tumor in it. These particular ones are just a little. It's hard to tell exactly. You know, there's all this darn pleural sac stuff is just taking over. All right, so as we go up the spine, this all looks nice. Just kind of checking everything out. Got a little, no, there's the one right there. So that's a lumbar. I think that's L3 or L3. So L3 might have a small tumor in it. Because here's your sacrum's down here. And then when the hip connects to it, that's where I'm having problems with pain. But, you know, you keep going up and pretty good. A little bit of, but otherwise looks pretty good. The spine's good. You know, you need your spine. You need your liver. A little funny spot there. Going the wrong way again. All right. Okay, so we get through the spine. Not a whole lot going on there. That's awesome, because you got a spinal tumor, you're in trouble. All right. All right, and so I think that's one of the hip tumors. At least one in each hip. From here, you can kind of see how big the bubble is. I think this is the less active one. And then the liver, it's normal. It's supposed to be glowy. It's a very active organ. All right, and then the other hip. Let's see. So there's that tumor in the hips. I think I just missed the other one because we're so busy looking at the other stuff. Oh, this one's the hotter one, yeah. Yeah, so you can kind of see that. It's really hard to tell if that's, you know, because you look at the healthy parts, there's kind of, you know, less dense areas. So it's kind of hard to tell if this is a less dense area or if it's from the tumor. You know, I can't tell if it's connected or not. But anyway, yeah, it looks like it's right. It goes right to the edge too. Okay. Yep, yep, yep. All right, so that's the left to right one. Not sure which one this one is. Oh, the top down. This should be an interesting one too. All right, so this is from the face to the back. All right, so here comes this is your sternum here, and the manubrium's a little bit higher up, and your ribs connect to that. Yep, there's the left side, and guess what that is? That's the pleural sac. And there's the heart. You can see lung. The heart's here. Okay, because the tumors are confined to this sac. The sacs are not connected as far as I know. So that's why this lung here, as to date, as of this scan, is still quite clear. And the lung fluid, the lung capacity is normal. All right. Okay. Yeah. Yeah, just that poor little lung is just squished. But I think I'm adapting to the reduced lung capacity. A little bit of lymph node there. Uh-oh, my tummy is making noises. Don't do that now, tummy, I'm busy. There's the sac of fluid. It's squishing my lung as well as all this tumor activity. Okay, so remember these are slices, so you can see how thick it is. Goodness. All right. Oh, so there's one of the tumors there, and there's the other tiny one that's there. But you know the most of the activity is just here. It's mostly right here. And this darn thing is also, I'm going to get that drained because that would be good. Every time I breathe, I can hear myself crackling and wheezing, so it's like, it'd be nice to get that drained. But anyway, so now you kind of see that. Go back up to the little black and white one here. Where'd it go? I think it's this one right here. Yep. Oh, it went back to no, it didn't go. So it kind of explains what's going on here. So again, it looks terrible, and it is kind of terrible. But the good thing is, it's not in the lung. It's squishing the lung, but it's not inside the lung tissue itself. It's not infiltrating the lung tissue that where your blood and the oxygen levels are intermixed. So that's good. Even though their lung is getting squished, it's not being compromised by the tumors themselves yet. It could still happen. And this side, as we saw, the lung tissue is perfectly healthy. That little warm spot on the liver, and then a little warm spot on L3, I think it was. And then these are the little hip tumors. So overall, not bad. That's another lymph node there. And these are just lymph nodes. So lymph nodes I don't care about as long as the liver and kidneys and brain stay clear. You know, when we go look back at the hot spot here, you kind of look at, what's it doing that for? Go back. Kind of any kind of funkiness. I mean, it's my head's a little bit crooked, so it's not going to be perfectly, but there's no like really weirdness that's going on. It's just pretty symmetrical for the most part, so it's a good indicator that maybe things are kind of stable in that area as well. I've never had any brain tumors diagnosed yet. My last MRI for the head was clear, so that's good. So other thing, I think, let's see, that was just junk. Okay, this is a CT PET. All right. So count rate. So this is what they, how they, what do you call it? My brain stopped working because of the radiation kind of tapers off over time. So kind of, you know, how much radiation was coming out as they were scanning. But anyway, so there I am right now. That's where I'm at right now. That's why I get a little short of breath pretty easily. But luckily, the heart was fine. The kidneys are doing what they do. The liver's pretty good. You know, the spine is at one little spot. One little spot, I'll take that because when I first got diagnosed, I had so many tumors on the bones. So I'm happy. We stayed on the same medication, even though this progressed some. It's not spreading. It's outside of that area. And these tumors themselves may not even be the same kind of tumors that are in here. So that's another thing to consider because you can have more than one type of breast cancer cell growing because these could be hormone negative, they could be hormone positive, they could be HER2 negative or HER2 positive. And right now I'm on a HER2 positive regimen with chemo, and so that suppresses the hormones. So this could be a surgeons of triple negative right here. This could be all triple negative breast cancer. Well, all the other ones that are semi-responding are probably still HER2 positive or hormone positive. But if I had to guess, and if they were to do a biopsy, I bet you anything this is HER2 negative. I mean, yeah, HER2 negative and hormone negative because it's not really responding. In fact, it's growing. So, and that's, we're going to probably have to address that in the next 2 months right before after the next scan comes out. So I imagine in the next scan, since this hasn't gotten better, it's gotten worse, that we're probably going to switch to Enhertu. That's what my doctor said. And so Enhertu is pretty good targeted therapy. I'm not sure if we're going to do chemo with it or not. I'm not sure. So it's the HER2 drug Herceptin coupled with another drug. I don't remember what it's called. It's like Dex something. And it's had some really good reviews. So this might be the last 2 months on this medication, that's how it works with cancer. You end up switching meds, but you try not to do it too often because you run out of meds, and then you die. So I still have a couple of different lines that are already approved, and then once those are done, there might be trials after that. So hopefully I still have a few more years. It just depends if the body responds to the medications. You know, it could be anywhere between 6 months to maybe 5 years. So it just depends on how my body does. And to be honest, the cancer treatments are taking a toll. I'm about 40 pounds lighter than I was a year ago. I can see, my intestines have been beat up pretty bad. So my ability to digest food well isn't as good. I'm trying to reintroduce what do you call it? Prebiotics to help rebuild the gut flora after the really bad round of GI issues that I had that probably just killed everything. And the liver and kidneys seem to be holding up pretty good. They're not showing any terrible signs of stress. So, geez, I'm really hoarse today. Pretty good overall. So, just something we have to keep an eye on is this darn pleural sac, and then the fact that it's squishing the darn lung. But good for the most part. A little concerning about this. We get another PET scan. Let's see, that was 420, so 3 months from there. So 5, 6, so 720-ish. A couple more months, and we'll have it a new picture for you. Anyway, so thanks for watching, and if you have any questions.